I'd like to call to order this
No, you have to
special,
open session and close.
Yeah.
the
I'm
meeting.
sorry, declare the board is in open session,
That was 5:08.
5:08 PM. Entertain a motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Aye.
John and me.
Okay. I'd like to call to order this special meeting of the Board of Education at 5:10 PM. Roll call.
Mr. Berger,
Here.
Ms. Capabianca,
Here.
Mr. Corey is excused, Mr. Predis.
Here.
Mr. Ucolito, Ms.
Here.
Ona here, Mr. Kisco.
Here.
Ms. Richardson, Ms. Toder. Here. Mayor Carbone or no. Mr. Barlow,
Here.
Ms. Ferguson, Ms. Klamazewski, I see her.
She's done.
Ms. Labomsky. Here. Mr. Petrozelli, no. Ms. Schulte.
Here.
Ms. Beans. No, we have Ally instead,
And Josh. I'm here.
and Josh, okay.
Thank you. Discussion, community health clinic.
So we do have folks from the site who can give you some perspective. So we just want to go around and introduce. Shelley, you want to start and then go all the way down, just so that you just name and roll.
I'm Shelley Hubbard, principal of middle school.
All right, Scott. Pencil.
Claudia Ocasio, visitor translator in Kevin Jensen.
Barbara Beebe, school counselor, Torrington High School.
Mike Moretti, regular ed school social worker.
Raina Santiago, Torrington High School nurse.
So just to give you some perspective in terms of what's going on at the site, we thought it might be helpful, and I don't know who wants to start and just kind of share. I know that we've had community health and wellness since about 2009, 2010. So those counseling services have been going on for quite some time. But I know we've expanded those services, and the medical services obviously are the health services. So start admins, just kind of give an overview, and then we'll jump into Claudia.
You know, at the middle school level, the nutrition is just beginning, there is day weeks, so they've been really working on getting kind of. So they've only been in full swing probably 4 or 5 sessions, because by the time it gets started. They've begun to collaborate with the nurse to sort of help areas of need, such as physicals, and that type of service that we can support our students with who may not have access to be able to obtain those services.
And pretty similar over at the high school. First, we just starting up with having the APRN come in this year, and she's been collaborating with our school nurse, and then the other folks, of course, coming in for mental health supports as well, and mostly doing physicals, some sports physicals, so kids can participate in our sports programs as well. That sort of thing.
Okay, you want to?
Yep.
Well, I make copies for you. It's something short. I'm gonna read it for you. Okay, for those of you who don't know me, my name is Claudia Ocasio. I have worked in Torrington Public School District for a little bit over 10 years. Over the course of my professional experience, I have had the blessing and opportunity to work with the Hispanic community here in Torrington. This family immigrated to United States for a better life and a true pursuit of happiness. Their home and countries face political, economic, and social problems daily. And at times has to fight for their own life. The journey to the United States for them was a way out, a way to live a better life and establish themselves in a safe community and lifestyle. Unfortunately, they are met with rules and regulations that many struggle to understand and adhere to because of language barrier. Many families encounter a summons from immigration service saying that they must enroll their children in the public school system. This is tough for them to do with a lack of knowledge of how the system works. Here, where the community health and wellness program has provided the necessary help for the community and its children. Some of these children have lived through a terrible fate. They have persevered and pushed through traumas that most of us will never see or experience in our life. Community health and center and youth and family program has been helping these children mentally and physically by providing all the necessary resources for them succeed and overcome any obstacle. The program, with help from medical professionals, has granted physical that are crucial in registering children for school and providing therapy session for those in need. The policies and procedure in place for sending kids to school are overwhelming and require an abundance of information from families. We help in any way we can and provide the resources necessary for the success of our community. I hope that this shed light on how crucial providing this service and resource truly are. We all work hard together as a team and to strengthen the Hispanic community to build a better future for our children. If you have any question, please feel free to reach out to my email, cocasio@torrington.org.
Thank you, Glenn. Bart, you want to talk a little bit? Yeah.
I didn't prepare a statement or anything. I think all of us, one of our goals is to like just boldly disrupt the barriers that stand in the way of our students and their success. And so one of those things has been our partnership with these outside communities, so children, youth and family, and community health and wellness. Whether it's the mental health services that they provide in the school for our students, or whether it's students who are registering, like Claudia was saying, coming from other countries or other states. This is just a way for them to access the things that they need to even get registered in our schools, those things that hold them up and hold up their registration process. And everything that we do with these community organizations is cleared by their parents. We have forms that they're signed before they work with our mental health professionals. There are probably 7 or 8 forms that they have to sign before they can work with the APRN and community health and wellness. So in all these things, the partnership between us and the parents agreeing to these services and these organizations. So it's been a huge benefit for our students.
Yeah, and to echo, excuse me, to echo what Barb and Claudia were saying, all these groups that come in do break down these barriers between parents and the outside services, students and the outside services. I'm a social worker myself. We have 3 social workers in the high school. And we are all mostly doing crisis management in the moment, figure out what's going on. We don't have the time to do in-depth, hour-long trauma therapy, in-depth family situations. So these people who come from CYM and community health and wellness are trained in those and can give the time to students that they need. Whereas, we have over 1,000 students in the high school, and we need to, meet their needs the best that we can. I know that we do groups from the McCall Center. We have groups from CGR coming in too, and to echo what Barb was saying, in order to have them in there and have students participate in those groups, parents need to sign off on extensive forms for these groups to say why they're here, why their kids have been chosen to be part of this group. And you can't be in it unless your parents sign off on it. So, and that's pretty standard based on all the community services that we provide at the school.
So for us, as you know already, Connecticut state law requires that students have a physical in 7th grade and 10th grade. There are students, like Claudia mentioned, who do cross the border, who aren't able to get these resources at a doctor because they're undocumented. So community health and wellness has been able to give these students a physical and their immunizations for free, no cost, as long as their parents sign the HIPAA release form. It's a giant packet. Parents have to fill out, go through everything. It's not just Hispanic kids, these are kids Also, we had 5 or 6 already who've had physicals that don't have income to go to a doctor. And it is state law that kids do have immunizations and physicals. We no longer require religious exemption. It's a way for them to stay in school. If we don't get the documentation that we need and we don't know if they're even healthy enough to be in school, they will be unenrolled. So this is kind of that bridge to get over to keep the kids in school where they need to be. That's what they've been doing. Mental health, they are like a doctor's office. They can refer. They are not mental health physicians like psychiatrists, but they can refer as any doctor's office would do. And that's what they've done for a couple kids.
Thank you. Open. If board
I have a lot
members
of
have any questions? Okay, let's try to do one question at a time and then I'll come back to you guys
start
so that
down.
everyone can get an opportunity.
Well,
Gary?
I'd start with some comments. This is Roberto's sister, by the way. And Rudy.
Questions?
I think it's Metro High School. I think there's a little bit of confusion as to what, at least my concerns are. I mean, vaccinations and physicals have always gone on. McKenna used to be free, he did it for 62 years. So I think I'll start with that. That's really something that I always knew was going on. It goes beyond that, though, and I'm not sure if anybody at this table can answer some of the questions, because they really relate to the rest of the services that we were told are being provided that we weren't aware of. You know, a lot of other issues that a lot of those things should not be happening in the school, in some of our opinions. But what you're doing now,
These folks can answer the site stuff, and then community health and wellness can answer
right?
in the next meeting, the
Yeah.
other.
I
yeah,
personally, vaccinations
contractual
and
and those kinds of
physicals
things.
should happen. You know? It's beyond that, that I don't think many of us are aware of what goes on, or what they're proposing, I should say. We're caught a little off guard.
You all set?
Yeah.
Okay.
Let's see what's
Go
going
ahead,
on.
Sue.
I echo what Gary said. I don't think any of us are questioning the services that you all provide. And we're very grateful for that. And I think we're all in agreement that the services are needed and they're great for the kids to have, but it goes beyond what we're offering and what it's community health and wellness services that we weren't aware of. And the way we found out about it kind of blindsided. So I think that's the purpose of, that's where our concerns are, not with anything that you all are doing. We're aware of it and are very grateful for your services to all the students.
So maybe we can backtrack and maybe you guys can't answer this, but I think part of the confusion is what actually is happening, right? So we understand there's mental health supportive services going on, which has been going on, I think.
Since I was in school.
Yeah, a long time.
Right, That's not the issue, I don't think.
I think the confusion is on the medical care component. And please tell me, maybe this is the next people, I'm not sure if you guys can help, but I think what we're trying to understand is what medical services are being provided, right? Like, there's some concern, I'm just gonna put it out there, there's concern, like, are we talking about birth control? Are we talking about condom distribution? Are we talking purely about physicals, vaccinations?
I can answer that.
Go ahead.
So in our school, it's physicals, immunizations. Some of these students, however, are already patients with the community health and wellness. But whatever they discuss at their location, at their doctor's offices is what they take care of. They don't discuss they won't do like a check-in visit at our office, only for new physicals and immunization. So if the kid was due for one, they would only do that. So if a kid went to the doctor at their location and had a specific question for birth control at their location, that's their coverage. They can only do that there.
Right.
Like any doctor's office would, but in a school setting, no.
You know, we
But
don't-
We don't even.
I don't-
promote it.
I
Go
don't
ahead.
think I anyway, speaking for myself, I wasn't under the impression that you all were having those conversations with the kids or any of our social workers. It's what was presented to us
Well, it's what they're
by
proposing.
community health,
Yeah,
huh?
Community health is proposing to bring a lot of these into the school. In the proposal.
In the proposal, right,
If
that
we
we
don't know it.
received.
In the grant that was
in the
already.
grant that was on.
Yeah,
I have two friends that work in schools similar in size to ours, started with 30 kids. One of them is 70% of the 1,500 student population. Now gets in-school services and the kids get taken out of class for dental, for medical, prescription. And it's become a nightmare for the administration in those schools. I don't think our administration is capable of having that, nor should they, but that's a discussion with them, not you. Those are my concerns. I completely
Right.
unrelated. What
I
you're doing is
agree.
great. Listen, Ms. Santiago.
And we can talk more at the
Correct.
6 o'clock
Right.
about what we had agreed to as far as
Right.
services and what we said, no, you're not offering within our district.
Yeah.
but
So-
that doesn't coincide with what was sent out. It's already been made public, those services that we just talked about, birth control discussions, prescriptions, abortion counseling, those that were things that were in the handout. Those are the things that, the services that were being offered. And it's already been distributed.
What handout?
Yeah.
The packets that we had, where it was,
I know what you're talking about. Sue, you're talking about.
On their website.
yes,
Okay.
that was from the link on social media for parents to go to for this, what we're offering. That's what was on that link.
But I think you're gonna hear them tell you at 6 o'clock that that
They
was an error.
changed it?
No, that was an error.
Okay, that's a huge error.
Yeah, to be honest.
Yeah.
Yeah,
Yes,
that's huge.
I have some
That's-
questions for them about that too.
Okay,
Okay,
well, that's
so
what,
we'll
that's
take
where
this
we're
circle
coming
back to-
from. In no way, shape or
The
form are
edits they
we
made to the
questioning
commission.
anything, any services that Torrington Public Schools is offering, or any of the services that you offer. It totally unrelated, but thank you for your time and for giving us that overview.
Jeff.
I actually do have a question that I think you guys can speak to. Two things. One, I don't know if you're aware of this, but the scope of the grant, this grant has already been received. It was received in 2021, and we're just discussing it now. So that's part of why we are having these conversations. In the grant application that was approved by the federal government, the Community Health and Wellness Center said that they want to add an additional 400 students to their medical and to this program by the end of 2022, which is a very large number of students. Now, this encompasses all of our schools plus Wolcott Tech. So full disclosure, it's not all our schools, but it's almost all our schools, okay? So I see that as a huge disruption to the educational process. And I can see, if principals disagree with me, you can say so, I'm not gonna put you on the spot, but I think that anybody who has spent any time in a school building would probably see where that might be a concern with that number of kids being pulled out of classes, not at the schedules, based on the schedule of the clinic, not based on this child's schedule. What happens with missed work, what happens with all these other things, right? So that's a much larger scope than what is currently in place and what has been in place in the past. That's part of why, when we discussed this last week, some of us requested to see the project narrative and what was submitted to the federal government prior to them being awarded this grant. So that's a lot of kids. That's not going to be a negligible impact in the district. Okay, so but my question was, I just wanted to make you guys aware of that, so you know what it is that we're asking questions about, because I think we may be talking past each other a bit. So this is part of what was sent on behalf of our district. I'm reading from the project narrative from the grant that Community Health and Wellness Center sent to the federal government. It says in here, on behalf of our district, we commit to providing space for service delivery, including medical care services, and we will collaborate on embedding CWHC's care team with the school's existing clinical counselors and nursing staff to ensure appropriate plans of care for students. We will identify and refer students to CWHC's school-based services, and we will develop care conferences as an avenue to address high-risk students and concerns. In addition, school staff will work together with CHWC to ensure proper communication, education, and awareness for parents of enrolled students. So I read something like that and I get concerned about how much of a time imposition them meeting their grant requirements is going to place on our staff. That's a concern for me. So I don't know how much, and it may be uncomfortable for you to answer this, so don't answer it if you're not comfortable, but I would wonder what has been asked of you as staff members, in addition to your current responsibilities, where now you have to network with these other people. Now you have to be part of care conferences. Now you may have to be part of other things that weren't previously part of your responsibilities. what does that look like in your daily schedule? That's a question that maybe you want to answer. And if you don't want to answer that, I understand. But that would be something.
I think at this point, it's not reached that scope. So at this point, I mean, primarily, we probably work mostly with the mental health professionals, and when we refer a student, it usually comes out of, you know, an SST meeting or a 504 meeting or something like that. We fill out a form, we give it to one of our social workers, and then, so Claire Pepper is the one who works closely with mental health professionals. We give it to her, and then she goes ahead and coordinates with mental health professionals who are in our building from CYF and Community Health. So for us, that scope has not been reached at all. I don't know what the APRN.
She hasn't asked anything of us. The students, the only thing she asked us to do is like, if the student has a free period, only during their study hall. If they're caught up, they come down to the office for their physical, which is an hour. They pull the curtain as any physical would. It's an hour long, and they just do their thing back there. They don't ask anything else extra of us.
And the mental health professionals also pull kids out of study halls for their counseling session, whether it's every other week or every week, whatever it is that they have established.
And for me, lucky me, they are bilingual. So they don't need English.
But the projections, they indicate in their grant 20 to 25 students now. They want to be at
When the
400,
grant was submitted.
up to
So last
400
year.
something by 2022. I suspect they'll be looking within 5 years to 1,000 if they're still, but that's.
Well, if the
reasonable-
grant
you
wants to
use their
get refunded,
percentages.
they have to continue to
So you
demonstrate
can throw
growth.
500. We don't have.
Let's
to-
just try to stick to questions.
Well, I'm getting to the question.
Yeah,
So
so hold on a
If you
minute,
get to
let
that
them
500
finish answering and then John, and then we'll go to Gary. Sorry, just wanna,
Oh, I thought you were done. I'm sorry.
Is
Go ahead.
that based on, so I understand that, CHW is in one school a day throughout the week. So is that basically, somebody said it was almost all the schools? Who said that?
It is
all
almost-
schools.
Plus
Yeah.
over Wolf.
So that's
So-
400.
I mean, there's 1,000 kids here, so at the high school, I'm sure there's roughly maybe a little bit over half of that. So I mean, 400, I guess, throughout all the schools. I guess it makes sense why they would say that, but I don't know if they want to keep the protections going, like, we have not discussed anything like that, so.
I can speak a little bit about my experiences in my past district. Full-fledged woman was at our school 5 days a week. And as an administrator there, I thank God that we had them because they were providing services that our kids wouldn't have anyway. So if we're talking about them missing instructional time, the level of need that the students have often is taking away from their instructional time as it is. So for simple things like getting an antibiotic, a student is sick, parents are working, can't get them to the doctor. If I didn't have this wellness center that I can bring the students to, that delay for that antibiotic may have been many days and the students are out. We would use it for things like conjunctivitis, those types of things, as long as they have permission. And with our newly enrolled kids, and we do have a growing, I know in my building, growing bilingual population, that was the way I could get them enrolled quickly. So it served that purpose as well as those kind of, if we think of our families that don't have the means or don't have insurance, we had cases of students like diabetics who would not receive their care had we not had this free service. So as an administrator, I never saw it as impeding on my time. And there was a need that we had them there 5 days a week. And if we're thinking about that counseling component of it, we have social workers and we have counselors, but their roles are very different. Whereas through the wellness center, they could get to the therapeutic needs, which was more the root cause of what the problem was. Our counselors are working with the academics, trying to have so the student doesn't miss that. And our social workers are dealing with some type of community care, but they're not providing therapy. And that's what the wellness center can do. And our students are coming in with so much trauma. So they're having those needs that we can't meet any other way. We're simply band-aiding them. So if we don't have these supports, the kids will go without them. And it takes more of our time on the back end to deal with the academics that they're falling further and further behind, gaps in their academics, when they miss school because they don't have medical care. Those are whole days that they're missing. And sometimes something as simple as an antibiotic, kids could be out of school for a very long time, and then it can develop into something more serious because they didn't have that initial So we saw it as nothing but an amazing support to be able to provide our kids with things that they didn't have. We kind of saw it akin to, we offer free breakfast and lunch because our kids sometimes aren't eating. And for us, it was sort of like that, but that was medical care and the mental health care, so that we could get to the work of educating them because we had these partners helping us with this.
I think just to echo that a little bit, just to briefly go on that, like we can't expect our kids to be successful in school if they don't get the services that they need, whether it be the physical or the mental or the social emotional needs. They can be in school in the building and just be going through whatever it is at home or in their body that we're not going to find out. But to expect the kid to succeed when they're going through so much is one going to put them in more of an academic setting that's not going to be appropriate for them, and they're not going to succeed because of that. So having mental health services, having, you know, now CHW with some of this with some of these things here, yeah, that opens the door to them understanding what might be going on, and at least gives us some sort of insight as to maybe how we can approach it better. Especially with kids who have suffered through so much trauma, kids who are diabetic, who, you know, their levels spike to over 300, and then we have to figure out what to do in the future with that. So there's a whole lot of things that our outside services do provide that, you know, like I said before, at the school, like us in the school, counselors, social workers, that we can't really address at the moment because we're doing already so many things on the academic side, as our translators and as social workers. So just to echo that point, I think it's very important to understand that these services do provide other outlets for us to understand our own kids.
John,
Kids aren't going to succeed if they aren't in English class either. You said the intake interview is an hour and you pull kids out of study hall?
Physicals are generally at the doctor's office as well are 1 hour long. So that they are an hour.
Right. Study halls last an hour?
Around there, yes, I believe so.
Well, my question is about class time. Do kids lose class time because they are in these appointments?
No.
No, it's a study hall.
Yeah.
Just
so-
study hall. That's true in the middle school too, Shelley? Thank you.
For now.
You call them study halls at the middle school or you call them something else?
Labs.
Okay.
Gary,
Again, theoretically, it sounds great. With 400 to 500 kids, you bring up free lunches. Torrington has, I think, 70% free lunches right now. We don't even check to see if the people qualify for free lunches. It's probably closer to 40%, and it's not that expensive. If we really want it to be difficult, we could probably even reduce that number. But it happens, and everything's, if it's free, kids coming from somewhere else, they need it. But the other 50% may not. You can't control it. And the education process, and you're from Danbury, that's where you're from. You know, that's a great town. Well, up there. But how do you trade off the kid coming out of the classroom, which they will, with 400 to 500 children? You're not going to get around it. And making up that time, because some of the teacher friends that are on the teaching side of this in schools that do this say it's a disaster because they can't make the time up. The parents are no longer involved in this process, which I think is a problem. When the parent gives all the responsibility over to the clinic, they're not even familiar sometimes with what may have transpired during the day. They may hear 2 or 3 days later. Their homework's not given in. So when they don't do their homework, the teacher's told, well, you have to just let them bring it in tomorrow or the next day because it's a disaster when it gets too big. For the administration, I'm told, but more specifically for the teachers on the lower level, because they can't make it up. Our system in Connecticut of education has seen grades plummet over the last 18, 17 years, Torrington included. It's a terrible situation we're in. And my opinion, I know some others, is that we can't afford to take these kids out of the classroom. Maybe after school, because they're after school buses, let them come after school or let them have advanced more hours. I don't have a problem with the clinic at all. I mean, if you need the services, get the services. But how many more things can our administration and the staffers in the school system do? And if it's beyond your expertise, well, then it really becomes a real medical or behavioral issue, which as an education system, we can't be responsible for, in my opinion. It's not something we are capable of fixing. I mean, yes, we can talk to the child, but once the child leaves for the day, if the parent's not involved some way, shape or form, or if the clinic gets back to them 4 days later, what's happened in between? Now, I've got 6 kids now. I went to Torrington. You know, I grew up in Torrington. My parents, my dad's family was first generation, didn't speak English. But my mom always took me to the doctor and they all worked. I'm not saying the families have to do this. I'm saying maybe we can accommodate around the school system so that it's not during school hours. So that, because there is a bus, there's a late bus. So I'm at a thorough, well, depends on what we're offering, which is not your issue. But there's no doubt that it helps the children. But by and large, according to my friends that go through this, it divorces the whole family child process between the community centers that might be in the school system. And by the time the parent actually may get involved, sometimes they can't get the parent. That's not healthy. So how do you determine whether it's the family not being actively involved or the trauma that they've been through that's causing the problems? I don't know. But how can we fix that problem? I don't understand how you can put it together. We need all this. I agree with you. But
Gary, do you have a question? I'm sorry.
well, yeah, how do you guarantee us that? Because we've suffered enough in the school system, kids not learning with behavioral problems and just lack of classroom time. How do you guarantee it? I mean, how would you guarantee it? I don't think you can.
Yeah, I can only speak to what's happening now.
That's 20 kids.
Right, and,
20 kids.
you know,
So
right
make
now,
it
we're not
500.
having any issue with maintaining that policy, so. But, you know, I can only speak to what's happening. right
If it were 500 to 700,
But it's at all schools, not just high school.
it doesn't matter. It's 500, 700 kids. We don't know how they'll handle it, but we're going to take it on as a responsibility. We'll see people in the court. We'll see families in court. Anyway.
Essentially, if they're gonna see one child, let's say it takes an hour, there's
Hmm.
7 periods a day, then each school can only see 7 kids a day.
And you have trauma cases.
Once they get to their threshold that they meet their contractual agreement, it's
know
gonna
that.
overflow into taking kids out of the classroom to provide those services.
Right.
The other question I would have is, can I go?
Absolutely.
Okay. Sorry, I kind of just jumped in there.
Question. He does
The
that.
consent form, all of you mentioned consent forms, and just so you know, last week, the consent form that we saw basically gave the children, adolescents, the option to opt out of informing parents. Now, we were told that that was also an error.
Yeah.
So my question to you guys is, the form that we saw last week, was that actually presented to everybody to date? Like, were they the forms that they were handing out? Was that the same form?
They had
I don't
their
think they know.
erroneous form at the beginning of the year, and then when we, after our meeting and realized that it was the wrong form, we gave a call, talked with them, they fixed the form
Okay.
immediately, everyone got the form.
So
It was
that any
distributed.
children, adolescents read that and opt not to inform their parents for
So,
for any services.
so those forms had to be reissued to the family, they had to be re-signed. The other was null and void
Okay.
because it doesn't exist anymore.
Okay, but my question was, did any students, adolescent age, that received the old forms opt not to include their parents in the informed decisions? Did anybody take that option on the form?
I think you had the option. It wasn't on the form. You had the option to do that at the visit.
Okay, did anybody do that at the visit?
I think-
That's our big concern,
Right,
that
well,
we're providing services and the kids opt out, they don't have to tell the parents what's going on.
I think you'd have to ask the next group because none of these folks will be giving those services. So you have to ask community health and wellness.
Okay.
So take this.
My
one-
last, I ain't
Oh, I'm
done,
sorry,
I'm not
you're
done there, I
You're
guess.
done.
Okay, fair enough. Now, my last question is, these services, is this a pathway to how many behavior health specialists do we have on staff?
Well, it depends on what you're looking at.
Laura,
Because we have,
Generally speaking, how many?
Like social workers, you mean, right?
There's
For the most
3
part.
Well,
social
there's-
workers.
Sure.
at the high school.
right, so.
At the high school.
You want to just go
Just the
over
high
how
school.
many, and then Laura can jump in terms of BCBA's and.
No, I think, no,
Just-
not
just in
those.
general.
Not those people.
Social workers and school psychologists.
All right, never mind. Is this program a pathway to outsource services from these people across the table?
No, it's
the
different
that
services.
They
like-
provide would not be the same as the services that a social worker, for example, provides.
Right.
But aren't they bringing in social workers?
bringing in
Community
this
health?
stuff.
It's a different level. I think Michael was
They're
trying to
clinical.
address this. It's
LCSW is coming in.
therapists
Okay.
Right,
versus,
they're clinical. social
yeah.
Okay. Okay.
Are you all set? Mike?
Yeah, I just want to make that clear.
Gary,
Just I'll end it with a comment about, they made this one mistake.
question.
Well, no,
Question.
but everybody understands it. They understand it too. That form could have brought us to a pretty significant legal battle if it wasn't caught by us. They made that mistake up front with 20 kids. If it's 500 kids, how many times will we face this liability? We're an education process, education system. I love having local people, Torrington people, working for the school system that worked for us. There's a direct responsibility. There's someone you can call, or even somebody who's designated, to coordinate. But we're talking about the hands of 500 to 700 children over the next 3 or 4 years in a community health and wellness system, which I know does a good job locally, but is outside any of our expertise, and anybody in our system is capable of monitoring or controlling. It's a huge responsibility. I don't know we can afford to shift those resources, and there will be some internally, away from education into supporting whatever's required for 500, 400, 500 kids on a daily basis. We just don't have it. So anyway, you all do a great job. Thank you. It's a
Yes,
matter
you have
of-
another question, and then I'm running out of things for this group. I have a lot of questions for the next group. So one of the documents that we were sent was a letter that went home to parents and guardians on August 8th from the Community Health and Wellness Center about the school-based healthcare program. Do you guys remember, and maybe this is one of the questions for the admins, do you remember this letter going home?
August 8th, she said.
Well, that's the date on the letter. I mean, this was sent to us in the packet of information that we received.
Yeah, that's it, that's it.
That's
That's all back, so.
Provided it to us, right? It didn't,
Yeah.
the school wasn't even in session at that point.
Right. So has any communication from the buildings that you guys are aware of gone home to the families about this new opportunity?
Yes.
I thought it came from
No.
district level.
This letter went out, I don't know, first, second, third week in September.
This letter went out to,
So people were
Parents.
aware of what the
Went home
services
with the
were.
kids.
Right.
this went home with the kids.
Community Health and Wellness actually dropped off the copies.
Probably sitting in the majority.
I don't know the parents got it.
Yeah.
Right.
Well, so I'm just curious, because usually stuff like, a lot of times stuff will get sent to us too. So I wasn't sure. I hadn't heard from anybody parents that they had received this letter, but we received it in our packet. So I just wasn't sure. So
Yeah,
you guys.
I can tell you because they actually dropped them
Mhm.
in my office. All counted out per building, and I'm the one who asked the custodian to take them around and bring them to the schools and email
Okay.
the principals.
So it
to say,
was all,
"Please."
so it wasn't
please
the
distribute.
blast, it was just paper.
Correct.
Correct.
Yeah.
I just want to clarify something that you had stated. And I think I know the answer, but I want to make sure everyone understands the answer, because you had stated that undocumented students could not get medical care at a regular doctor's office. However, the public schools are required to register all undocumented students.
Without physical, we can.
Correct, but we can't turn away students because they're undocumented, but they have to get, I'm just trying to understand, but they
Yeah.
can't really access the medical
I
care.
try to give them the most help that they need. But it's been very difficult for them to get it because they crossing the border, they have nothing with them. They don't even have money to go to a walking clinic and pay $50 for a visit. $50 was last year. I really don't know how much is this year.
Okay, so could they go in? I'm just trying to understand. So if they're undocumented, can they get care?
Only to the walking clinic.
Well, no, they can go to this, they can go here. if they want to go to their
Well,
outlet.
she's-
Okay, yeah. But I went into school, I mean, but they could still go to community.
Yeah, before.
Because they,
Last
they
year,
mentioned that.
Yes. But this year, since we have this, it's been so helpful for this community.
So they can be undocumented, but they can't go to school without a physical,
Same,
No,
no one
makes
can
no
come to school
sense.
without a physical.
but you can come,
Yes.
you're not undocumented being not a citizen, but you
Right.
still have to get a physical to be able to come. It makes no
Yes,
sense.
very
It
clear.
makes
Right.
no
Right.
sense.
Correct. But
I
that's
can't even
But
believe
that's
we're having
required,
these conversations.
Most of them, these students who come from anywhere, they're coming with immigration judge orders that they provide us, that they have to be registered. So.
It's judge's order saying they have to be
Yes.
registered in school.
Yes,
regardless of any identification.
Right.
yeah, regardless of anything, and
Okay.
of course, they come with nothing.
Yeah,
I will add
Go
in,
ahead.
sorry. Most of them that do cross the border, they do get a physical at that border and they start their immunizations, but Connecticut state law says they have to have a Connecticut physical on file. So that
or
could be
they can
required.
start.
That's- It's a
Ours is so
start,
much
it's a
better.
start,
Mhm.
yes. But that's usually what, sometimes what's in their file is the start of their immunizations and the physical from the border. not Connecticut.
The other piece to just add in, and not, this is petty, really, in the grand scheme of things. But once they're registered,
Mhm.
but if they don't have the necessary medical documents, we can't have them attend.
Right.
So they're absent.
Mhm.
They now start.
With the absentee count.
Oh, can I add on to that too? It's not just immigrants, though. We're finding out that it's basically half the students. We're having something going on with that right now. Or for field trips, where we're noticing kids didn't even get their physicals. It's, I was told by the other nurse that the official letter for 10th grade goes out to the new 10th graders that they have to have a 10th grade physical. And some of them don't have a physical, parents, so I didn't know about it. So it's not just the undocumented immigrants that
It's,
don't have.
it's
a physical.
much of the
It's
student
the
population.
whole broad.
But at what point do you have to stop policing? And I say to the administrators of the buildings, which students have physicals and don't, so that they can go on a field trip. I mean, this is becoming now our issue to provide medical care. And I'm not saying that I think all these children deserve it and should have it, but now we're competing with education at this point. So where do we draw the line? There's so many things that need to be discussed about this that weren't. And it's just unfortunate that you have to be kind of on the receiving end of this right now, but I think we'll have more questions for community health and wellness when they come up, but there's just a lot of questions.
But just to
that we need
clarify, they
answered.
need those physicals
Right.
at those grades to be in school.
Exactly.
Not just
And-
field
and
trips.
That's not a choice.
Okay, so
And that's
then
how it's
schools,
always
again,
been.
right.
We've
Okay,
always had.
but
that
we-
requirement to do that.
I understand that. I remember having to get my children to their physicals. I think all of us had to do the same thing, had to get our kids to the doctor to get them to school. As a parent, that's one of our responsibilities. Our responsibility is to educate these students, which at what point is this going to get in the way of that education? And that's one of the major problems I have with this. There's others, but that's one of them.
Well,
And I
it
think
is
we
a-
need to make sure that as a board, we all understand that that's an issue, that it could affect their education time.
Well, I can tell you that it's an issue, all the requirement that they need to provide, which I'm agree with that.
Mhm.
But for them, it's really hard. And most of them, they don't drive, it's so many.
So many
issues.
things. I know, but
Yes.
I, again, to our concern, our primary concern is educating
Mhm.
the children.
And I think with immigration judge order, so that's. a
That they have to go to
very-
school,
I
sure.
think that that's a very legal paper that. And sometimes I have to say, well, but if you don't provide me what the school is asking, I'm sorry, even with those orders, I still need everything.
So I guess for the physicals, wouldn't we want them to have them front loaded at the beginning of the year, right? Rather than all of our staff chasing these people down. I mean, maybe for those routine physicals, maybe we could look at possibly utilizing the late buses at the middle school and have 7th grade vaccination clinics after school on certain days where, if that's what you want, you come on these days, right? Like, it's just, how do you, if it's a matter of them coming to school or not, because we're kind of up against a rock and a hard place here, because if we keep them out of school and they're unexcused absences, we're gonna get penalized.
So
So,
they don't learn because then they're not in school.
right,
Because they can't be, because they haven't met the statute.
but then we'd have to involve our attendance review panel. It's convoluted.
Well, and a
Jen.
lot of how this shakes out is gonna come down to, because we, the Community Health and Wellness Center received this grant based on a comprehensive primary care clinic being established, not just a place that does physicals. So that's where I think some of this grant verbiage, we're gonna have to talk through with the next people, because I mean, like, the idea of giving physicals to kids that just cross the border so they can attend school, like when this was mentioned to us in December, that's the type of scenario that was presented, and nobody really disagreed with that. It was this being a much larger thing that encompasses many, many more things. So I don't think anyone disagrees with, like, Claudia, the points that you're making or anything like that, just so you guys know that. I do have a question, if I can ask a question to the superintendent.
Go ahead.
How did this come about, this grant and our districts either, because in one place in here it says, in the project narrative from the grant, it says the Torrington superintendent contacted CHWC about the need to expand services and improve access to healthcare services for students. But then in another place, it refers to it as CWHC's proposed service expansion. So how did this all come about with the grant aspect?
So what happened was, because we were going through COVID, because we had mental health services for a very long time, and then we went through COVID, we knew that we needed much more mental health services. So we did reach out to them. Ed Aram's also on the board. So he said, hey, I'll make this pitch. I'll let them know that we really have this need in terms of mental health services. So that was us reaching out to Community Health and Wellness. The other piece came about in terms of them coming to us saying, what about physicals? What about, what are your physical needs for your students? And we said exactly what we had shared during December, and exactly what Claudia is sharing, and many others, that the physicals, the sports physicals, the vaccinations, we're really talking about healthcare in terms of those parameters. Could the nurses also come and talk about health and wellness or nutrition, or go in classes, and in particular at the elementary, share that information on healthy habits or good food choices and those kinds of things, because they would be able to be there, which all sounded wonderful in terms of the services that they were offering. And the whole idea was we could customize this to our district. It wasn't going to be all the services that were offered at Community Health and Wellness is what they would be providing. Anything that they would be doing would be with parent permission. It would be very similar to what Shelley's examples were. If the parents had signed off, they're not able to get their child to a clinic, maybe they don't know that their child has pink eye, but they do, and they need a prescription, or maybe they have a scratchy throat, but it may end up being strep, and that APRN could check for strep and then could write a script, all with the parent's permission. So these are basic things that kids go through, right? That you've had a lot of illnesses, and you have your own kids, that they get sick and they share these things in the classroom. So this was all basic services. So this all met our needs. And nothing to do with sex education or pregnancy tips or passing out condoms or testing for STDs or having any of those conversations. Our own nurses don't do that, and certainly we're not having an outside agency perform any of those.
So unfortunately, it was in the paperwork.
Like we told them. Right. We had several conversations around that.
Then why did the wrong paperwork get handed to us and out to the community? If you had those conversations, that shouldn't have happened.
And
And if you read, if the documentation was read or run by the board or legal, we would have caught it in enough time. I think the contract was signed in July is the copy we have, and now we're in November.
we did, but we didn't have the permission slip at that time.
But we had
As part of
meetings
that.
that we should have discussed this, and we wouldn't be here right now, taking up their time, taking up everybody's time.
We did have the discussion in December.
December,
of 2020.
I remember I watched the meeting and we were supposed to get back together. And when we met last week was when we were notified that the contract had been signed in July. And we were not notified. We
And
being
had
the
no
board,
Meetings in the summer at all.
we have had board meetings since July.
Mhm.
And it wasn't brought to our attention. And I think under our policies, it's actually, you're required to bring it to our attention at the next board meeting. And it wasn't.
As superintendent, I have the right to sign certain contracts.
Right.
And so we don't always bring every contract to the board. We can write that into a policy should we decide to.
Can I ask
This is
Shelley,
kind of a big thing to enter into without discussing with the board. All right, you're right.
Shelley, can I just ask you a question? Because you did this in your, I'm just curious if, so just say someone gets treated by the APRN because they have strep throat. And the child doesn't get better. And did the clinic have responsibility or the school? So just say the strep ends up going to the child's heart because they needed a second round of antibiotics. And you may not know the answer to this, and maybe it's an answer for community health. But
What typically happened is anytime that they saw the students, they called home and they talked to the parents. So, that communication piece was there. Where it went beyond that, they didn't really come back to us with.
Okay.
I think the only back-to-back communication that I saw with the wellness center was between the therapy sometimes and our social workers or counselors, when there was a signed agreement from the parent that they could share information, and then that information was helpful for our social workers.
The way I understood it too, is that children who did access the wellness center in school, who are aligned with a pediatrician in town, that the APRN would then be in contact with the pediatrician and they would co-manage.
Yeah.
You have to wait till 6.
This is actually kind of important.
That's next. I'm sorry, we're gonna get to
We're
the next
we're
one.
not in
No,
that.
we're not in this
session yet.
next meeting yet, sorry, almost,
I mean,
not yet,
Not
when
yet.
we get to the next
okay, because I
meeting.
mean, for what you guys are paying me, you might want to hear what I have to say, but
Next,
that's
We will
fair
in the
enough.
next
We don't
meeting.
know who you are though, so we need to be introduced.
My name is Michael Curie. I'm the district physician. I've been here for this is my
Okay.
6th year doing this, and I've been sort of at the ground floor and all these kinds of
He has
things.
been in this meeting?
No, Dr. Kerr, we're gonna start the
He's in
next
the
meeting
next-
that you're
Okay,
part
I
of.
mean, I
This is
just-
just
Yeah,
a
it's-
pre-meeting kind of.
It's starting us
Okay, I mean,
momentarily.
I can-
apparently,
The
yeah.
issues you're bringing up are completely
Sounds like a-
relevant to my perspective. So anytime you're ready to hear, I'm here for your help.
Which we will bring up.
Okay, does anyone have any other questions on the community health grant, specific to the grant?
Well, I have more questions specific to the grant, but I can't ask them. I mean, I feel like there are more questions for the next group. If
Okay,
that's,
right, yeah,
you
that's
know.
fine.
I mean, I will ask, and do we have 6:03?
Do you have anything else for this group?
Thank you.
Thank you.
I can just save it. I can save it. for
All you
next.
do.
It's in relative to the permission forms.
Kathy, did you have something?
No, I just want to thank them for all they're doing in our schools.
Thank you.
Thank you very much.
Thank you so much.
Thank you for coming
you, guys.
tonight.
Have a good night.
She's all grown up and I'm nervous.
I know.
Entertain a motion to,
In order. Let the roll show that we have every committee member and and Jess as board members. And Fiona as a board member.
She wants to switch.
Ah, okay. As well as members of the staff and Marissa. You're not on the committee. You're just visiting firewoman. Fire. Approval of the agenda. Will somebody move to approve the agenda, please?
so moved.
Second.
And this will be with the understanding that if the discussion on community partner report goes long, we will move the in-district student assessment data presentation to the next meeting, right? So anyone that wants to argue that can do that now. Otherwise, all those in favor of accepting, approving the agenda, say aye.
Aye.
We have an agenda. We've been given the minutes electronically and in print form over the last couple of minutes. If you've had a chance to read them, will you please make a motion to accept them or to correct them if necessary?
I make a motion to accept them.
Thank you.
Second.
Motion has been made and seconded. Discussion? All those in favor?
Aye.
We have approved the minutes. Members of the public and staff may bring to the committee's attention information, ideas, or matters of concern related to all the duties and responsibilities of this committee. This committee will not allow comments regarding specific staff members or personal grievances. The time for individual remarks will be apportioned according to the number of speakers and will be limited to 5 minutes per speaker unless extended by the chair. Is there anyone from the public who wishes at this time to speak? And Josh, is there anyone out there in Cyberland? Okay, so I read that for nothing. But while I was doing that, I was reminded I yet again failed to recognize Ronnie. Joe Armino is also here as a committee member. Fortunately, this time, because there's no play going on right now, so Ronnie is with us. Okay, discussion and next steps. Torrington School report. Now, I'm going to start this just by saying that I had the chance to visit Torrington School 10 o'clock on Monday morning. And Halloween, right? And if you've never been in an elementary school or haven't been for a long time on Halloween, it was a lot of fun. I found Waldo. Waldo was easy to find. Max was looking for wild things. Harry Potter was there. Lots of witches, superheroes, and enough princesses to make Pixar's studio just collapse, just boom, explode. Happy, busy kids, all doing what they're supposed to. A lot of reading instruction. I don't know if they start with reading instruction or whatever. It just seemed like a lot of the classes were working on reading. A couple kids drudging their way through phonics. We're doing phonics again. Yay, phonics. And that's good.
Great.
That's good. Sounds. We heard a lot about sounds, and that's all very good. And happy kids. And Kelly, you know every kid in the building, right?
I do know a lot of the kids' names.
Yeah.
Many of them.
Halls were quiet and orderly, as were the classrooms, and that's all important to me. So I just want to report on that and then turn it over, Kelly, for anything you want to say.
I'll keep it short, and I know your agenda is long, and you just had a report from Ellen a week ago about what's going on at Torrington. We just had our pumpkin dash, which is like our fun run event. We just started it this year as part of our 520 wellness committee. We did it as a fundraiser. We didn't raise a ton of funds, but we're trying to work on adding some things to our outdoor experience for kids, some play equipment. We were also recently awarded a 520 grant to add to our outdoor play equipment because we do have a new preschool voice program. And our play equipment is either 5 and up, and I think we're younger than that. So we were able to we're going to be ordering a seesaw for that. Our pumpkin dash was well attended. It was right before the TMS, what was it, trunk or treat? So the kids were able to come in their costumes, run around the field a few times, play, and then go right to trunk or treat, eat lots of candy. Wellness event tied to the kids. And then we have upcoming our Veterans Day ceremony, which will be happening on Veterans Day here at Torrington. We were originally planning sort of a reverse parade, but we switched it to an indoor assembly because we were afraid it's going to be too cold to be outside for any long period of time by that time. So we are having an indoor assembly. The high school color guard is coming around 10 o'clock. Part of that event, you guys are all welcome to join us at that time. As far as academics in Torrington goes, I know we present later on in the year our data, but
for the first year since pre-COVID, our baseline data in the fall has looked better than we ever had. So we're really excited about the growth that we can make from now to the end of the year. Our interventionists are working with students. They did a quick intervention cycle right away at the beginning of the year with the end of last year's data. And then they started their first cycle with fall data. At the beginning of October. So
Everything that's supposed to be happening is, and then some. Questions for Kelly? No questions?
I just had one question. Are we seeing better attendance and better kids getting to school on time this year?
Student attendance is still an issue. It's definitely better, but now we have lots of different things, like we've got RSV going through, we've got the stomach bug, still a little bit of COVID, but that's not really the primary thing. It's just a lot of sickness and it's affecting staff and students. I just think we haven't been around germs in a while. We're doing masks and washing our hands incessantly, and now we're not doing that. And, so I don't think we have a lot of absences that aren't warranted. Let me say it that way. But there are people definitely who are sick. But we have our lead team is active and has visited many families this summer and are still visiting families. We're adding families if they become an attendance concern. And our attendance committee meets once a month to talk about, upcoming students and whether they need to either get a letter, have a meeting, what's the next step for that family.
Question. Go ahead. Is once a month enough to be meeting with the attendance team? Do you have a protocol around that, Sue?
Yeah, so we have some tier 1 that happens with the classroom teachers. So the classroom teachers have a threshold that they're in contact. If the child's been absent twice, they call it. It's a positive phone call. We miss you. We didn't have you in school. We're hoping you're okay. If the child hits a threshold of 6, our parent liaison's making a call just to remind them of what the attendance policy is. And those just automatic. We don't have to have a meeting for that to happen. They hit the threshold, we have a spreadsheet, and those things happen. The letter happens at a specific time. We just sent out our first round of letters yesterday. And then the parent meetings, the first round of attendance meetings will happen during parent conferences. So there's kind of things that are just happening even though we're not meeting to talk about it. And we're getting information from classroom teachers regularly with regards to if there's a new student bubbling up, or whether they need to do more.
Does that answer your question?
Yeah.
So it's ongoing throughout the
So
month,
it's
and
not
then there's
just
like
one-
an official formal kind of where the whole team comes together monthly. Yeah.
Yeah, the work is happening all the time, but the meeting has.
Once a month.
Other questions about Torringford for Kelly? No questions. Thank you, Kelly. Thank you very much. And thank you for a pleasant visit on Monday.
Thanks, Bill.
Okay, community partner report. Sue, this is yours.
Our guests are here. I think we have, thank you all for joining us. Do we have enough seats?
Yeah.
Okay, come on over, take a chair. Thank you for being here. And then we'll just have you introduce yourselves. Just your name and what your, Dr. Curie.
Yes, there's
I'm sure
another, yeah, there's another seat. Yeah, there you go.
Yeah. So nice to see you all. Yes, we're all set. So we handed out a copy of your presentation, but if you could just, Jason, if you could just start, just introduce yourselves and just tell us what your role is with Community Health and Wellness.
Absolutely. Hi, everybody. Thank you for having us. My name is Jason Kirsten. I'm the Behavioral Health Program Director at Community Health and Wellness.
Hi, I'm Donna Urbanati. I'm the pediatric nurse practitioner in school-based health at all the elementary schools in Torrington, plus the middle school.
Good evening, everyone. I'm Gina Burrows. I'm the Chief Operating Officer at Community Health and Wellness Center. I'm an APRN as well.
Hi, everyone. Thanks so much for having us tonight. My name is Joanne Bourgois, and I'm the CEO for Community Health and Wellness Center. I'm also a nurse by background. So thank you again for having us here tonight.
Yeah, Ed Aram, board member for 15 years and treasurer.
For Community Health and Wellness.
Community Health.
Many hats.
Yes.
And I'm Michael Curie. I'm a pediatrician in town. I had 2 kids who were excellently educated in Torrington, and I'm the school district physician.
So do you want to, Joshua, do you have their access to your presentation, or Gina, do you have a disk or something?
If you want to send it over to me that way, I can put it over Zoom.
Pardon me?
If you want to send it to me, that way I can put it over Zoom for anyone watching it.
So would it be all right if while we're setting up for the specifics, I think my presence here tonight is to first say hello and meet with all of you, but also wanted to give you a quick overview for those of you that don't know a whole lot about community health and wellness and what we do and what does an FQHC mean, and there's always a lot of acronyms, right? So Community Health and Wellness is a community health center that was established back in 2002. So we are actually celebrating 20 years in service in the Torrington community. We have a location in Torrington, one in Winstead, and I'm very pleased to announce that soon a third center in the Canaan. So our services and as
Plus
a dozen.
Betty.
What's that?
Plus Betty.
Plus Betty, yes, how could I forget Betty? Betty is our mobile unit, so our clinic on wheels, and her acronym stands for Bringing Exceptional Treatment to You. And we actually purchased Betty to help get us out into our neighborhoods and into the communities. As we know, sometimes transportation is a barrier for many. And so Betty helps us get out to those areas where that does pose a problem and folks can't reach us. So we go out to them. And Betty was very useful when we were doing COVID testing. And right now we're involved in COVID vaccination and addressing homebound folks as well who can't leave their homes to get the vaccines. So we offer primary care services, mental health, dental. We are a little bit unique in that we try to make coming into the center to receive services convenient for the patient. So we also have a lab on site. We will next year have a pharmacy that will be opened in our Torrington location, not in Winstead. And so we have community health workers who act as case managers to help folks address their social issues that might present as barriers to their care. We accept everyone regardless of their insurance status. If folks are uninsured, we put them on a sliding fee scale payment plan. We give them financial assistance and we work with them to make sure they can afford their care. About 70% of our patients are Husky or Medicaid. About 10 to 15% are Medicare, and the remainder, a small percent of uninsured, and the remainder are private pay. So we don't turn anyone away. We make sure that we provide the access where we're located so that anyone can walk through our doors and receive healthcare services. So I wanted to just give you that brief overview in case you weren't aware of what we do here in the community, and then turn it over to the team here when they're ready to talk to you a little bit about our school-based health centers.
Thank you, Joanne. All right.
Looks like I did Christine, but I'm gonna bring your laptop off while this is starting.
Okay. Why don't you bring my laptop up?
I just sent it to you again too, Josh.
You can send it to me too.
Let's start out with school-based health center story. So the 17-year-old high school student presented to the nurse's office with chest pain secondary to a collision with another student during a sports game. He was in obvious pain and he was instructed to go to the emergency room. The student declined, stating he did not have the money to pay for an emergency room visit. The student was a new immigrant to the area over this past summer.
Could you speak up a little, please? We're on Zoom and I'm not sure the mic is picking up. We will be eventually. And I'm not sure that the mic will be picking up what you're saying unless you speak loudly.
Oh, thank you. Oh, sure. Thank you. I'll speak louder. So the school-based health center, APRN, noted the student to be a community health and wellness centers patient. He was assessed and in stable condition. She recommended that he be seen at a walk-in clinic for further evaluation, and the family agreed. He presented at the walk-in clinic and was instructed, as instructed, and was turned away due to his lack of ability to pay. The family was told that they could not be seen unless they paid $457, and they were not able to afford that. A phone call follow-up to the guardian found that he was home resting comfortably and sleeping. He had been given a couple of Tylenol, which provided him some pain relief, and some urgent symptom education was given to them so that they would know when to seek more urgent care. Upon awakening, the student was still having a chest pain and discomfort, and was instructed by the APRN to proceed to the emergency room for further evaluation. The family did follow the instructions appropriately as advised by the nurse practitioner. Through culturally sensitive care, the patient and family were treated with respect for their concerns, and the patient's safety was maintained. The patient did very well. So I thought sometimes a story is worth 1,000 words, so I wanted to share that good story with everyone. Right.
There we go.
Perfect. Thank you. So the agenda for today, Joanne has provided us with introductions. I'm going to do an overview, and then our behavioral health program director, Jason, will talk about behavioral health, and then Donna will talk about medical care. Next slide, please. So what is the value of our school-based health center? It is to address healthcare access barriers in underserved communities. And some of those barriers include transportation, especially in our rural area, time, costs, and gaps in care. We support health, well-being, and academic success for the students, and improve health outcomes through care coordination. So Community Health and Wellness received a grant from the Health Resources and Service Administration, also called FERSA. 27 grants were awarded nationally, and we were the only Connecticut health center awarded this grant. And the funding is for 2 years. The funding started in September 2021 and ends in August of 2023. So the whole first year we were getting ourselves prepared and getting Donna on board and making preparations. The grant allowed us to expand our current services.
Hey, would it be better if we asked our questions at the end? I do have questions on this, but I think if we start interrupting you, we're not going to get to your
Yeah,
questions.
let's do questions at the end. Let's just go through it.
All right. Next slide, please.
Next.
So our purpose is to serve as a bridge to close gaps in care for the students, to collaborate with our community pediatricians, to keep parents at work, and to keep the kids in school. So our objectives are to help health promoting behaviors, to promote healthy lifestyles, nutritional counseling, and help students get connected to referrals to programs like Fit Together and community nutrition programs, and also to connect students to any mental health services if they are needed. And this will all help to increase school attendance and graduation rates as well as we keep kids in school. Next slide, please. collaboration. So our school-based health center professionals collaborate with school administration, school nurses, school social workers, licensed behavioral health clinicians such as licensed clinical social workers, licensed masters in social work, licensed marriage and family therapists, and licensed counselors. We collaborate with the school counseling department, faculty, and community pediatricians as well. It's like who's eligible to attend our school-based health center is any student attending the Torrington public schools, and Oliver will get technical school. So those students are all eligible to be enrolled. Consent forms are required to be signed by a parent or guardian to be enrolled in the program, unless the student is an emancipated minor. Next slide, please. Next, we're going to talk about behavioral health, and I'm going to turn it over to Jason.
Thank you, Tina. So listed in front of you and on the screen are the services that we offer as the behavioral health providers in all of the schools that we're in. And I'm going to talk a little bit about not what's on the slide, but the process to get involved in the behavioral health clinic at the schools. So we work very closely with all the school counselors, the social workers, guidance department, to get referrals for any of the kids that are in need or want services from the behavioral health department. We get the names of the parents, we get the counselors or social workers to give us a signed release of information stating that they spoke to the parent and that the parent wants the services and they want their child to be seen either in the school or at our clinic here in Torrington. We then engage with the parent and have a very collaborative process of getting an intake done and getting those releases of information done so that we know that the parents are on board, the school is on board, and that the clinic is on board and that there's not a higher level of care needed. So for the behavioral health department and the medical department, it's a very collaborative process between the school and the parents and the kids that we're serving. Next slide. I'll turn it over to Donna to talk about the scope behavior.
My job as a pediatric nurse practitioner is to co-manage some chronic problems that we see typically in the schools, specifically diabetes, asthma, big one, developmental disabilities, these kinds of things. I work with pediatricians in the community, engaging families and parents every step of the way. Parents will get health status updates. With every visit, I see them. With every visit I see the child, they will get a phone call from me explaining my assessment, the plan for them, etc. And if they need to follow up with myself or the pediatrician, I'm more as to be seen as a link between the school and their pediatrician. And for kids who don't have pediatricians, a lot of the migrants that come in, the underserved, they have no pediatricians, they have no money. I'm their primary care. I will take care of them. I'll do their checkups and take care of their immunizations that are mandated, etc. I'll see sick visits in the schools, urgent care visits, emergent visits, things like gastroenteritis or viral stomach bug, which you might know it as, head lice, skin infections, strep throat, these kinds of things. I can diagnose them right in the school, call in an antibiotic for them, treat them while the parent explains, the assessment, the findings on the testing that was done in the school, and treat them. And the parent will pick the child up, swing by the pharmacy, pick up their prescription, and they're good to go. They can follow up with the pediatrician as needed, or myself at school-based health. Again, inclusion, parental inclusion in every child that I see is paramount to what I'm doing. Parents will always be involved with every child I see. So I will get their input into the child's history, follow up, that kind of thing, plan, make sure the parent is on board with what I'm doing and agreeable to the plan of care that I have for the child. We'll take questions now.
Okay, so now we are ready for questions about the program, not necessarily about the contract, but about the program. I realize there's a lot of overlap between.
Right, so which topic do you want us to ask questions about first?
Okay, first Jess, then Sue,
Well,
but,
she's gonna have more than I.
well, yeah, one question and then
Mine kind of span the board too.
Right,
as far
mine's
as-
very quick.
quick, okay,
Okay.
It
so
is.
promise quick.
It is. On the medical history for prescribing and things like that, do you have the students' medical history at your fingertips when you're prescribing? So you know if there's allergies to medication?
Yes, I have. Well, first of all, we have Lisa's information, so we
Mhm.
have, and we'll be getting medical records. If the medical records are not there,
Mhm.
then I will make a phone call to the parent to ask about allergies, history, that
Mhm.
kind of thing.
Okay.
They have ear infections, you know, how many have they had during the year, how's
Yeah.
their hearing, et cetera. They check their hearing in the office and the school stuff as well.
Okay. And you're seeing students throughout the day?
Yeah. Oh, yeah.
Okay.
The school nurses will see a lot of the kids that come in for like fluff, you know, they
Mhm.
want to have a cough drop or they have anxiety and things like that. But the other kids that come in, that the nurses will refer over to school-based help if it's something they can't, or they feel like they can't handle.
Mhm.
The parents working, can't get out of work to pick the child up, that type of thing. So I'll see them. They'll refer the child over. I'll see them.
Thank
Okay.
you.
Jess, you're up.
So we'll start with the prescriptions. When you write a prescription for a child, they receive the medication in school that day?
No, they'll receive it at the pharmacy. The family, when I call the parent, I will ask what pharmacy they want the prescription called to,
Mhm.
and I will send it there electronically. So they'll take the prescription up at whichever pharmacy. they use.
And that is not in line with what was in the project narrative.
For instance, if they come in and they have strep throat, they
Right.
need an antibiotic, I will call the parent, ask for allergy, do an assessment, call in the antibiotic to their pharmacy of choice.
Yeah, no, I understand what you're saying. What I'm saying is that that is not in line with what was in the project narrative. That was part of the grant. And I'm trying to,
That may have been referring to vaccines
no, it was not. It was referring to in-house pharmacy services, which is,
at our health center.
it did not say that though. So,
Yeah, you know.
It was
schools
an
do
in-house
have pharmacies,
pharmacy
right?
in-house.
So we do have an in-house pharmacy that we can also, if a child or a parent says, we will have another one in next year. But if they say we don't really have a pharmacy that we use, they're welcome to have the script sent to our in-house pharmacy at the health center. So that might be what the confusion is.
You're up again if you want.
yeah, because it specifically says in-house pharmacy services and 340B pharmacy services with community RX.
That's right.
Right,
So
there is,
that-
there was an in-house pharmacy at Midgeon Avenue.
And the reason we included that is because 340B program, if you're not familiar with those, offers medications at a discount.
Right.
For folks who can't afford their meds or they have high deductibles. So if that were the case, the way we could help that is to send it to that pharmacy. Since that was written, remember that was 2 years ago, our pharmacy on site for their own business reasons have closed, but we have plans to reopen another one coming soon.
So my primary concern with that is that I wanted to make sure that students would not be leaving the school building with medication.
No.
No
Okay.
way.
No way.
So here, well, but they can based on how this is written, and that's the problem, right? So if this is so old and outdated,
It's 2 years.
this, right, but this is what was submitted to the government. And so what was approved, like, we did not receive the entire grant application. We only received the project narrative. There's also letters of support, attachments, budget narrative, other things that were also submitted along with that, that we haven't seen. So we can only ask what, I would like to see those other documents, but for this evening, this is what I'm going on. But this was what was submitted to the federal government. So that's a
Because there
pretty,
was an in-house at the time
Right.
yes.
to submit it.
And we wouldn't, so there's a lot of rules and regulations around dispensing medication in a non-health center setting. So we would never plan to do that, except for if there was an instance where, again, a child doesn't have a pediatrician, didn't have a primary care, the school was requesting that we, see them in that capacity. They would probably need vaccines updated and whatever the requirements of the school are. So vaccines that are controlled would be the only thing that would be administered if that were the program. If we were to call a prescription anywhere, whether it be to the health center or to Walgreens or CVS, that's going to be up to the parent to go pick up the prescription.
So. All right, permission, well, I'll go to this next. The scope of services that was just described to us in this presentation differs from the scope of services that has been offered based upon what is put out there to the community currently, and it also differs from what was in the project narrative submitted to the Fed. So I would like to know why that is different. And so what, just for anybody who's not familiar with this document, this is the flyer that's currently available on your website. In-school services provided, and I'm just talking about the medical care right now. Chronic disease management, diagnosis and treatment, physical exams, health education, prescriptions, referrals. So that goes beyond the things that you just said. Okay. So why is there a difference in what we're being told would be offered versus what the community is being told would be offered versus what the Fed, you guys told the Fed you were going to offer? Can you explain that?
This is just a synopsis.
Yeah.
It's a short, very
It's a
synopsis. of what
broad
we're doing.
overview. Health education could be a variety of things, right? We
Yes.
just tried to summarize this for you. And we tried to explain what health education might include, but all of those things on that flyer are what we can offer. And again, it involves parental consent. So if a parent says, please don't do that, we're not going to do that. And we're going to say, okay, great, follow up with Dr. Curry or your pediatrician. But the co-management of chronic conditions, again, is a collaborative effort. So that if a child has asthma, diabetes, whatever the case may be, they're being followed by their pediatrician while they're in school, they need to be monitored in some way. We're happy to take part in doing that.
And the pediatrician will always get a copy of the note when I see them. My plan, my diagnosis and assessment goes to the pediatrician the same day.
I'd like to speak. I think you guys are gonna like what I'm about to say. So, and this is my perspective as a pediatrician in town, been around for a long time. My wife has been in practice for a long time. The best thing about this program is that it offers me as a pediatrician, a professional set of highly skilled eyes and ears to help me take care of kids in the building. Now, I've been in all the buildings in school. Now, I've been on the referring physician advisory board at Connecticut Children since they founded the damn thing about 17 years ago. So I've built collaborative care models with specialists in Hartford. And that's my goal with this. Now, it's easy to focus on the kid who has no doctor and has a runny nose and has never seen anybody. And that's a very, very small piece of what this offers. I think the strength of this kind of program that is both novel and will give it longevity is the ability for someone like me as an independent practice, private pediatrician, to recognize a kid in my office. And this is, I had 4 this morning. I have half a day on Wednesday at 4 this morning behaviors. Okay. And I can call up Donna and say, hey, listen, and get the parents on board. And one of my goals is to have a lot of the referrals come from the pediatricians themselves. So this isn't the school soliciting or kind of picking out, although they can do that. But it's for me as a local member, okay, as someone who's been in practice here for a long time to say, hey, to say to the parents, I have the opportunity to get an extra set of professional eyes and ears on your child to help me help you and your family. And that's a very dynamic and interesting thing. And I like to emphasize this because this allows community health to use their resources to partner with somebody like me, because all the pediatricians except for Lucy Benzoni are all in private practice, okay? And we can then partner so that we are working together. So if I start a kid on ADHD medicines and I get the parents' permission, and remember, they know me, so this isn't kind of, coming from the outside. So I can't imagine a school board member would ever get a call from a parent. What the hell is this school-based nurse doing? It's like, well, you signed up when Dr. Curie asked you if you wanted to do this and you said yes. So there's sort of coverage in that sense, so that it's not somebody inside the school doing something completely independent. And I've been the doctor at the Foreman School for about 7 or 8 years, but the doctor at CJR for, I don't know, 6 or 7 years as well. And there I have really good nurses. And I can say to the nurse there, hey, keep an eye on this, or talk to the teacher, that kind of stuff. And this is what this kind of allows. And the excitement that I have for this is just that sort of thing, because for me to get quality information and to be able to do health nutrition, health education and nutrition education, and to do disease education, and to have kind of more sled dogs pulling the sled and work. The goal is for us all to work together. And even if there's some weird thing that involves the thing that you guys don't want to have in the papers and that kind of stuff, the sex, the drugs, the rock and roll, as a pediatrician, I'm a phone call away from Donna. And she can say to me, hey, Dr. Curie, like, this is what I'm dealing with. And I can send the kid down to my office right now. So we don't want her to feel isolated, and we don't want the school board to feel like there's some weird health thing that's going on in the school that there isn't any oversight. And I really want to emphasize that the best part of this, as far as I can tell, from having practiced in town for a long time, is the ability to have a co-management setup. And again, the goal, and we had many discussions about this, is not for her to try to see as many runny noses and strep throats and that kind of stuff. The pediatricians in town are very good at getting folks in for that. And there might be a very, very small number of that. But the other piece, and I think this is a different thing than I think most school-based health centers have been able to do, because if you're in an urban setting and you have to try to interact with a large, say like the Yale Primary Care Center that's on Longworth, like the schools are not connecting with them. But in this case, because we have such strong primary care pediatricians, we have such strong skill set at the community health center, creating an access where we can collaborate inside the school. And just as an aside, from my work on Fit Together, I'm on that board as well. You know, we built the fitness trail up at the middle school. You know, our biggest thing is how do we, in a good way, kind of bridge the gap between inside the school and outside the school. And as a practicing physician in town, this is the kind of thing that I've never seen before, and I'm very excited about. So I think this is a big positive. And the legs that this will have, if we can get this off the ground from a collaborative, co-managed way, should really, it's almost, I mean, there's always weird things that happen in medicine, but I don't see anything that would reflect badly on the school, because it's very well-trained professionals working together with excellent oversight to help kids with both the behavioral thing, which I think is very, very important, and, to be honest, sort of chronic issues. And because we as the pediatricians can be integral in getting the kids signed up for this kind of thing, that means that the parents are immediately on board, and they're not going to be calling school board members and going, what the hell is this program doing? Because it's like, well, your pediatrician told you and you signed. So that's
don't call us.
Well, sure, fair enough. But you can say, like, you remember the part where Dr. Grant signed you up? So that's my little presentation, and that's why I'm excited about this.
I'll look forward if you want to give somebody else a chance.
Yeah, let's go ahead, Gary, your turn.
So I'll step back a little bit. I don't have a problem with what you do, but I learned how to use Narcan at your facility a while back.
Gary, can you speak up?
I learned how to use Narcan at your facility. I don't understand why these programs have to be during the school hours. I think you need to look at how our students do right now. Our obligation, in my opinion, as a board, is to educate children. We are failing right now, not just us, but most schools in Connecticut are failing. And every year we go, the grades get lower and lower, and we keep throwing on stuff. I have 2 friends that work in schools that have these services. It doesn't really impact the administrators, it impacts the teachers.
Gary, is there a question there someplace?
Well, yes, well, I'm gonna tell them, the preface is.
No, I realize Dr. Curry spoke a long time too, but you know, we need to move
Sorry.
along.
But why can't you do this? And I would go along with it, right after school, because we have after school buses. Or if the concern is the student, because the parents have to get the prescriptions anyway. I don't think parents should not be involved with bringing a child to school. Sometimes it's not possible, but 99% of the time, it has been over the last 65, 75 years, no matter what the income strata of the parent. And Kareem and I, first generation of Italian, didn't speak English on my father's side. But during school, our kids can't afford to lose time. You're talking about 500 children, 400 to 500 children. It's not going to happen any other time other than classroom time. I know at one school, I think in New Britain, the kids get pulled out, they come back, the teacher has to make things up, they have to make the classroom up, time up. it's a nightmare for some teachers in that school. So we can't afford that right now. I think a better idea would, and I think it's a great idea, is to get together and try to find a way to do it outside the school hours. Because it'd be easier for the parents to pick them up at 4 o'clock rather than 12 o'clock if they're really sick. And it'd be easier for them to pick up the prescriptions if the parents can't get out of work until after school's over. During school, in my opinion, I think a lot of the board members feel it's not going to work, nor do we like that idea. I'm not so much concerned about the services as long as we know what they are, but outside the school hours, the parents are more involved, more than likely. And you can do whatever the heck you want. Maybe use some of our space, as long as there's that legal, that firewall, but we can't afford to have children missing classroom.
Right. and that's
Especially the
exactly
first
what
gen-
we're
The number of kids who access the school nurse's office on a daily basis. I was taken aback at the number of kids that utilize that nurse's office. It can be
I'm not
40
disagreeing.
to 80 kids a day that could leave class on their own to go to that nurse's office for whatever. They've got a stomach ache, they've got a headache, they've got sore throat, they want to,
But as
these
an
kind of
organization, we've dealt with that for 50, 60 years, and then the school's adapted to it. Organizationally, we have no idea what we're in for, number one. And I know of talking to people from other schools, the unintended consequences for the administrators and the teachers is onerous. It has not even been discussed. And I've read a lot of research studies on, and Purdue was one of them, I think another school, another large university was another, how to make a program like this work. And where they've been really successful, meaning grades, because we have not seen many studies that show this actually improves grades on students. Grades continue to go down. Where it is on the spectrum of what's going wrong in society, I don't know. But we need, as an opinion, as a board, to fix the education levels. The only way these immigrants are going to move on is to be able to read after they got out of high school, multiply, add and subtract, and get a good job. We're not providing that for many of our kids right now. Nothing to do with our teachers. Our teachers are great. It's nationwide. It's definitely statewide. How many more things can we bring into the classroom and take out of the classroom and take the child away from the education process?
I see this as a +1. So if the child's asthma is better because of this program, they'll learn better. That's just absolutely true.
But what prevents the child from going at 3 o'clock in the afternoon and getting the bus ride home?
Okay, let's stop. Does anyone else have a question?
What's wrong with that?
Okay, Sue has a question. Gary, you're done for a moment.
Yeah, go ahead.
Thank you.
Do we, and I know that well, I shouldn't say that. I don't know that there's no attorneys in the group, but from a liability standpoint, are we covered? Is there something built into the contract that covers the board?
Yeah,
Yes.
so it falls under our liability insurance.
Okay.
So the school's been provided with that certificate. And so if they're in our clinic being seen by our APRNs, then if something were to happen there, it's part of community health and wellness liability in our space.
Okay. So we're an additional insured or named insured?
Yes.
Both,
Yes.
either
You're
or?
an additional insured on our liability.
Thank you.
Anyone who hasn't asked a question, Glenn?
Yeah, just to piggyback off, Sue, general liability is 1 million, 2 million, malpractice is 1 million. And Board of Ed is named as an additional insured. Question to us, I don't know, is that enough?
Insurance limit, you mean?
Yes.
Liability limits?
I don't know
What's our
our
liability limit?
bylaws or anything like that for the city of Torrington to see. Well, any type of medical liability insurance or malpractice at $1 million, that's not gonna get you very far these days. I wouldn't
You have
think.
that on car accidents if you get in.
Correct. I'm just wondering if that was discussed or if we have any guidelines.
Well,
I
we
don't
could
know.
ask Dr. Curry what his
I think it's a
malpractice
1 million
lines are.
policy and then 4 million in aggregate is typical for like what my wife and I will have to pay individually. So from an institution, I mean, I don't know how you guys, if that's a similar thing, but
Yeah,
that's.
we usually do, our liability, we see 30,000 patients come through the doors on an annual basis
Mhm.
visits. And our liability insurance is around 2 to 3 million.
Do you have an umbrella?
It's like there's a per occurrence and then there's an aggregate. So
Right.
that's how
And
they.
so, if we needed to do programs like this, we needed to add, it's usually, we can do that and just put them, like we've done for you guys on the insurance certificate. if you say that it's a bylaw issue and that the limitation.
I don't know, I'm kind of
Yeah,
new
we
here,
could
I'm
certainly
just
discuss
questioning,
it.
I just want to
So
know.
that's
is-
what our insurance requires, same with the PTOs, it's all the same. So to be in our buildings, that's what.
Yeah, so if you said.
Okay,
1.3
but
million
providing
because
medical
9 months they
services
came
would
back.
be
Just
under
modify.
a contractor pulling wire in the ceiling. I think that there may be a difference there as far as liability insurance, having a contractor doing work in a building versus a contractor providing medical services in our building. I think there's a little bit more
Okay.
So your-
liability there.
Your question is, are we underinsured?
Correct.
Good question. Sounds like the answer is yes at this point.
I don't know.
I don't know.
Yeah, we have to.
I think something we should at least look at.
Okay.
We are identified as well, Susan.
Yeah, okay, thanks for, I didn't get a chance to read that.
Thank you. Lots of exposure, not enough insurance. Kathy,
Okay, so this is just a procedural thing. A child comes to you, and I know our school nurses cannot certainly diagnose anything like strep throat or, obviously they know if the child's having an asthma incident. My question is, so a child comes to you at 11 o'clock in the morning, they're diagnosed with strep throat. I think it's wonderful. You can prescribe, mom picks up the child and all. What happens to the child for the rest of the day? Like, does the child stay?
The child care exclusion guidelines would have to, and
He'd have to
they have
leave.
to go home.
They have to go home
Again,
immediately, right?
it's a very good question, and I think that, there might, again, the smallest piece of what Donna would be focusing on would be acute care, in my opinion.
Right.
And the idea being that the best way of thinking about this is if you have kids who would benefit from sort of an ongoing, both sort of observation and sort of intervention from an educational sort of piece, that is a service now that I can access as a general pediatrician in town to buttress my sort of plans. And like, I have kids in DCF care right now who would benefit from this kind of expertise in school. And then I can get feedback on many different dimensions of their care that would help me craft my treatment plans. And I don't quite have that set of eyes and ears right now. And you guys, well, you know me, I call the school all the time, okay? And talk to teachers and talk to principals and that sort of thing. But this is another set of professional eyes and ears. So it's easy to focus on, the strep throats, the runny noses, the puking kids, that kind of stuff. But again, the child care guidelines are going to those haven't
They
changed.
still have to wait.
So, but I think the real benefit of this program, and I just want to emphasize this, is the ability to have a more sophisticated, nuanced, and useful set of co-management between someone inside the building and someone outside the building. And as we build this, the kind of communication is going to mean the kids are healthier and that they're going to spend more time in school. And I think those two metrics are very, very important, because if we can get obesity under control, if we get diabetes under control, if we get the asthma under control, then those kids are going to learn better and they're going to be better students. And I think that's crucial.
And I agree with that. And I guess my point, Gary, to you is if it's an after-school clinic, you're gonna have a child with strep throat sitting in a classroom with 20 other kids all day
Well, they're only
long.
day-
And in
they're
my
only in
mind, I'm
school one day
thinking
a
that
week.
they're,
So, I mean,
well, I know, but what I'm saying is,
So on Friday, we can find the strep throat, but the other 4 days. we
But
can't.
that-
but what I'm
that's
saying
why the
is she
small-
would go and get the medication is called in. We're not relying on mom to pick up the kid who might have strep, take him to the pediatrician to be diagnosed, and then have to get the medication.
True, but again, given the schedule and the discussions that we've had that's sort of outside of, well, I mean, Sue were involved in this, okay? But the discussions was, how can we build a co-management thing? So the fact that Donna and the MA will only be in the building, will be in Torrington, I don't know, it's a Tuesday mornings, I'm just making that up, but it's like, that's her opportunity to engage in kids that have been already hopefully identified either by her, but mostly by us as general pediatricians in town, to say, hey, you would benefit from this.
Right.
And that's where the utility of the time, the regular scheduling and that piece, that's how her time would be exceptionally well used.
In that particular case, strep is a communicable disease.
And you have to go
I
home.
mean, that.
Right,
I will
right.
discuss that with the parent.
Right.
They don't come back until they have.
Exactly.
But, I will discuss that. with them. They will be educated on that. So they get that piece of it here.
okay, one more question for anyone who hasn't
Oh,
asked
no,
a
no, no,
question.
I have more than one.
Well,
You
you're
have
gonna
to let
get
me ask
one,
more
and
than
then you'll
one.
have to write them down and submit them.
Will we
Do
be
you want me
having another meeting about this?
Make a motion
That-
to extend it a little bit. I don't want
No.
to have another meeting.
The
about
chair
this.
has that prerogative. I'm not going to grant it. Fiona has a question, and then Jess, you'll get one more.
I just have a two-part question. So in the case of a student that doesn't have a pediatrician, if we treat them for strep, and we test them and they're positive and we prescribe an antibiotic, or you guys do, where is that follow-up? So what if after the 10 days, the student still has the strep and is out of an antibiotic?
In the schools, I'll see them in the schools, I'll follow up with them. They don't have, to be- I can be a primary care provider.
Okay.
So,
Or they could be seen in the center. 'Cause we had. Yeah, so if they don't have a TCP, they're not a patient of Dr. Curry's or any other pediatrician, and they happen to get sick, and Donna says, oh, you have strep throat, you have to go home. If they need to establish care with us, or we can even, refer, however that arrangement works, they can be seen with us, or they can establish care with a local pediatrician.
And then my secondary question is, if someone has a primary pediatrician with the way insurance is not wanting to pay for anything nowadays. So if my child, just say, has Dr. Curry as a pediatrician, I obtain service from this school-based facility, which you guys are then billing insurance. Are the insurance companies paying that, or are they saying, treating it like basically a walk-in versus paying the primary care physician? Because I'm concerned that people with private insurance that may access these services may get denied by their insurance for coverage.
So you have to pay, you would pay a walk-in fee versus a copay for a doctor's, an office
Yeah, so
visit.
we
Under,
don't
under
collect
Aetna,
copays.
that's what we would pay.
We don't collect copays, that includes for just regular walk-in. Patients have high deductibles. One of the things we were talking about before we came here, like physicals might be an issue with an insurance company, right? Because you're only allowed one a year. So if for some reason a physical needed to be done, we would be collaborating with the pediatrician, and, there's a child crying and Donna's mom says they can't go play football because they're gonna get kicked out of school. We would say, hey, Dr. Curry, your child is here, we can do the physical. That then would not be covered if the child went back to see Dr. Curry before a year. So it works the same way as if they were gonna walk in for an office visit. And we would make sure if it was commercial insurance that, we were doing what could get covered, and we don't collect any co-pays or anything that the child. may
Right,
have.
but is that communicated to the parent? Because my fear is that a parent would think that this is free services and then get a $700 bill because their insurance denies to pay it.
Right. So Donna will communicate again if the child is enrolled. That is some of the information that gets discussed or given to the parent in advance regarding insurance and how they pay for the visit. And then again, if Donna sees the child in the office, she's going to be communicating with the parent and or the pediatrician.
So before we see a student in the school, we determine how insurance is going to handle it, or after this, after they're seen, after they've incurred this expense, I think.
After they're not, there's no medical information of the form at all. On the form, there's no. service
One of the
provider
forms
number or
had,
anything like that.
one of the forms did have medical information. One of the ones that we received last week. It was a, I don't know about
The sharing of
today's,
historical. medical.
but it asks for,
Your
it's the
insurance
authorization to
information.
treat. It asks for insurance information. It's like the form that
My
you
apologies.
send out at the beginning of the year to families for same insurance questions. Yeah.
So, the parent needs to fill out the enrollment form, and part of that enrollment form is the insurance information. So that goes to our patient access folks that take a look and they verify the insurance.
So does it say anywhere on that form that the parent would be responsible for anything that the insurance doesn't pick up? So that there's not that expectation that the Board of Ed might be paying that difference is just.
Yeah, oh, no, we do say that we do not collect any co-pays or out-of-pocket expenses.
No, I'm not concerned about that. I'm concerned of the parents thinking that there isn't going to be a copay.
There is
no
There is no.
We collect no money from
We
the
just
parent.
bill.
What
the
if you have a
insurance and the insurance reimburses for an office visit. If that child's insurance required a copay.
You waive it.
We waive that. So there is no balance billing to anyone, whether it be the school for certain, the child or the parent. We waive for any school-based children who come in to see the school-based health center, we waive any of those out of pockets. So the insurance is only billed for an office visit. If the insurance goes back and says, oh, but now you have a balance of $40, we waive that and we work with the insurance companies to let them know. So the school-based health clinic children are, I'll say, coded as such. So when it gets to our billers, they know how to handle all of that so that the parents don't get a bill.
Okay, one more question. It's going to be Jess's.
Yeah, I mean, I feel like they would still get a bill if they had a high deductible plan.
Well, we're not collecting any balance or copays. So, and the insurance company will know not to bill the family and for any of those things if they're a health center patient. So if they happen to get a bill, then it was a mistake from the insurance company, but on our end, we put in safeguards in place for that not to happen.
I mean, I think if we could access the rest of, I'm very interested in the budget narrative. I'm interested in the revenue that comes in
You
from
can
the
have
insurance
revenue,
and
like-
what is supplanted. Like there's a grant, I couldn't tell if it was $200,000 a year for 2 years or $200,000 over the course of 2 years. So it's either $200,000 or $400,000 that's being received. And so I think that we
So the
should
grant,
see.
I can tell you right now, is covering mostly the salaries. We've been doing this since 2011, and we did it at zero our expense. So we had no funding for this. The grant was to be able for us to expand services that required staff. That's how we were able to get Donna. And the grant simply pays for her salary for the time that she's in the schools, for some of the LCSWs for the time that they're in the schools. And we actually put in a little bit of money to get supplies for their office. So that's what the grant pays for. We're not making money on this program. So when you say revenue, we're not rolling in the dough because we're here seeing kids.
I'm
When
not
they
saying
could
that
be
you
at
are,
the
but that is
office-
a word. When you look at budget narratives, there's revenue.
Well, there
different
is
things.
because we
You're
can bill for
receiving revenue
insurance.
because you bill the insurance. And I'm not
Right,
saying
but
that you
what I'm
shouldn't. I'm just
saying
saying
is
I'd
if
like
we
to see the
looked at
numbers.
Time Donna spent in the school, seeing kids and billing the 5 maybe kids that she might see a month or a week versus the 20 that she can be seeing at the health center, it's not program revenue that's, this big amount of money. We're doing it because we feel it's the right thing to do. It's valuable for the kids. It keeps them in school. It helps the parents. It helps the kids. We're not making money on this program. We're grateful that we were selected to be able to offset some of our expense to pay for the staff. But what Donna could be seeing in the office equates to about 20 kids a day. Here, we're lucky if she sees 5. So it's because we're working with the pediatricians, to Dr. Curry's point, to keep our kids well, who learn better and keep them in school.
I understand the argument behind it.
Okay.
No,
thank
that
you.
wasn't my question. My
That-
question.
well, it
no.
got answered at length.
No, but that wasn't my question. So my question is actually about the permission forms. So I see it says that all students are eligible to receive medical services provided by the nurse practitioner while she's on site at the school, as long as required consent form and other documentation is on file. My understanding of on file would be, this is just, you pass this in once, right? So a new permission form is not filled out every time the student accesses services. So I think that when we hear over and over that this is all with parental consent, that kind of gives one may draw the conclusion that parents are consenting afresh every time with a new form and things like that. And so I just want to clarify that does not appear. So you already said that was correct. So then my question is about there was some confusion about the form, the authorization to treat form that was online last week and has since been taken down. And it looked to me like the changes that were made were that 2 bullet points were removed. And the bullet points reference HIV testing for people that are 18 and older, which is legally, 18 and older, whatever, right? And then the other one said adolescents, while encouraged to communicate with their parents, can receive confidential services for sexually transmitted disease testing and treatment, pregnancy testing, family planning, counseling and referral, and substance abuse counseling and referral at our 469 Midgeon Avenue location in Torrington and at our 10 Center Street location in Winstead. I understand an adolescent may choose to receive confidential services. I understand that information regarding the above conditions will be shared with the adolescent's legal guardian if the adolescent agrees. or when there is a serious health risk that requires reporting by state or federal law. So that was removed, I'm guessing because it was confusing to people.
No, actually, it was removed because we are respecting the wishes of the school and the students to not perform those services.
But
So it is a law that if we have someone that comes to us at our center and says, I would like to discuss reproductive services with you, we don't need parental consent for that.
correct.
We have respected the wishes of everyone here that we will waive that, and we will work with what the school and the parents would like us to do, and that was to remove those things.
So I guess my question is though, because the law says that you have the right, minors in our state have the right to access those services without parental consent. This form did not get parents to sign off on this. This form just notified them of the law. Doesn't the law still exist, whether it's specified on this form or not?
It does, but not on the premises of the school.
But where does it say that though? I guess, and then maybe if all of that is in the other documents that we haven't
It
seen.
doesn't say it specifically. What I'm saying is that like all other school-based health centers, we work with the school, the administration. If they say, you know, we would like you not to do this here, then we respect that. It is still a law, so if a child comes to our health center, we're gonna do it. Because we're required to, but we're not the health center here, it's not physically 469 Minden Avenue, and so we can make some amendments to that. And all of the other health centers do the same thing, because we want to do what the parents want us to do, we want to work with the pediatricians, with the school administration. We're here to be of help and of service to you guys. So if that's an issue that causes concern, we've agreed that we're not going to do that here. But we will if a child comes, we're not going to promote that. We've also said, you know, if a child comes into the office and asks for those services, we're going to say, please go see your school nurse. And the school nurse will follow whatever protocol or policy has been in existence for those things. And that's how we've agreed to handle it.
Okay, so I guess I personally have concerns about the loss of educational time, that my concerns are multifold on this issue, but in relation to this specific issue, I am aware that the law says that students do not need that parental notification. And I'm also aware that your literature says in multiple places that you offer referrals and that students are referred at times to your main center. And so the main center is where these things are offered. So I would like to see something
Referrals maybe to community-based agencies, pediatricians.
Yeah, I mean, referrals can mean a lot of different
Right,
things, right? And
right.
it doesn't necessarily specify what referrals you're making and what reasons you're making them for. So that's where these things are the devil's in the details, right? So that is, I wanted to bring everybody's attention to the fact that that is still the law. And without a detailed list of what types of medical services are offered, what types of referrals are offered, what the process is, can students make appointments on their own? What about students who are 16 and over? What does it look like? What's the procedure for ensuring that you're calling and getting a parent on the phone and they're saying, yes, you can treat my child, because it's
The
one thing
consent
for
form needs to be on file.
correct, but it's
physically
on
on
file at the
file.
beginning of the year. So if my kid needs a physical, and so I'm like, okay, that sounds great. That's convenient. I appreciate that. I fill out the form and now it's just on file. A couple months later, my kid comes back for a different issue. You can't reach me for whatever reason. What happens in a situation like that? And you don't have to answer me because I know John wants to move on, but there are a lot of other questions that need to be answered with this. And I personally think the board needs to.
Dr. Curry requires, for example, but in the health center, our permission slips get done once a year, which is typical of most practices. And this would be no different.
But in most practices, a minor can't go to the practice without
And they
a
still
parent.
can't come to the practice without parental consent. We've just said that's why the permission slip is in place.
Right, I understand, but I think we're talking past each other.
Okay,
The
thank you.
nurse in the school though, too, only gets it once a year. So like,
Yeah, but she works for us.
Right.
no, but she can access information from any physician once you sign that HIPAA form.
Okay, thank you. Thank you for coming. And thank you for spending so long with us.
Thank you.
Thank you.
Thank you.
So I can have my meeting.
So,
I'm tabling everything else so I can have my meeting.
Unfortunately. promise to make people here to deal with.
You wish. I asked them to.
Okay, next item on the agenda is questions left over from last week about the
Thank you.
SBA.
Very much.
Thank you.
Thank you.
So does anyone have any questions, or is anyone here to answer questions from the SBA report we got last?
What, can we move
week
that to
at
the
the
next
meeting?
meeting? That's a
It's
lot
gonna
to
be
talk
2
about.
minutes. No, it's not. We've talked about it last time. These are you have questions?
Well, my mind isn't, I'm just an overload right now, I guess. It's
I
a
don't
lot to,
think people-
it's a lot to consume, and we carried the meeting over because we wanted more information to discuss
You know
the
what, if
statistics.
I may, it might make sense, since we're going to postpone the next data presentation on the internal and district assessment, to do those two things at the same time. John, maybe at the next meeting.
Anyone have any objection to that?
Absolutely not.
No.
No one has objection to that, so without objection, it is what we will do. Long meeting coming up on the 30th.
Perfect.
Board goals. Anyone give any thought to board goals?
Not yet, but I will.
Well, we need to do that sooner rather than
No, there's kind of a
later.
lot going on.
There is a lot, there's always a lot. You may have noticed, there's always a lot going on.
My thought is we haven't accomplished any of the ones we currently have, so
Right, I don't know
we would
why we're
remove
moving
them until
forward.
they're finished.
Well, I don't know if that's exactly true. Because I don't know, haven't we institutionalized dealing with COVID results? I mean, are we gonna think we're in the post-COVID era forever? Because one of our goals is oversee and support whatever is necessary to deal with the educational impact of the effects of prolonged distance learning.
Well, I think we do that every day.
Yeah, that's why it
Yeah.
need not be a goal. I think we've
Regularly.
established,
Right.
we've
So you
established
could-
the things that we need, the procedures we need, and then implement the capital plan as presented. We still want to keep that?
Well, we did that.
That's what I mean.
John's given, I mean, we've gone through the capital plan and that you're kind of going with it, right?
Just reminds me of that Mexican political party, the party of institutionalized revolution. And once it's institutionalized, it's not a revolution. They kept electing decadent and dishonest politicians, Mexico, but, you know, and then they got rid of them, by the way. They threw them out. So my point
So-
is, you don't institutionalize revolution. So once these are institutionalized, do you think they're done?
Well, to John's point, we are getting a new capital plan proposal next week. So, I mean, is that something, I don't know that do we need to carry that on school improvement? It's more,
The problem is the intention was a multi-year capital plan with a plan. to learn and get the work done in the schools.
okay. All right.
It's not a one-year.
So that should
capital
be-
plan.
all right,
It was
so-
a bigger vision. of
We're gonna get no
what's
place, so we will do that next month too. No, we will do that later this month too. Well, we're supposed to do this, you know, and we get tasked with doing it and then, okay,
On the next agenda item is still sitting on my desk. I'm sorry.
louder, please.
The next agenda item is sitting on my desk at the agenda, so I apologize. I don't have it.
Okay, so that brings us to the delegated sick board goals.
Oh.
All quiet on the Western
I was
Front.
Which one were you talking about, Sue?
Social media, sorry.
Oh.
Yeah.
I'm talking about social media, that's
The
what.
website, H.
H. Okay, so that's all quiet, but otherwise, all quiet on the Western Front. Now, I see Laura's here. Is there a tag update?
Not too much of one, but Andrew let me know today that they've completed the latest round of COGAT testing that needed to be done. And he will share those results with Steve once they are in, so we can determine if any additional students will require supports.
Questions for Laura?
When, how often are the kids getting the service?
That would be a question for the building principals, because I don't think it's the same in both of the buildings. Because they're both doing it differently during blocks of time that work best for them. So really, Mary Ann and Michael would have to answer that.
They're meeting with them once a week. And they're meeting with their library media specialists, so.
That's how
And
they
they're
used to
working
do it
on
weekly.
the materials together, so. The
Other
timing-
questions?
The time of the day may be different, but they're meeting with them once a week.
Other questions? Okay. Alliance updates.
We are meeting with our rep later in the month, so I'll have more to share possibly on the 30th. As
More
well.
to come. Forthcoming, we used to say.
That's right, forthcoming.
Okay,
Is this reversed, 7 and 8?
yeah, they probably, they should be taken in
The other way.
reversed order, yeah. So let's do topics for future meetings now. What do we want to do for
I
future
have some.
meetings? Okay, I already have in-district assessment, which we moved from this one.
Mhm.
And what else have we moved? For goals. Move from this one, and well, there'll be a media update.
I'd like to see
ahead.
more
Your
frequent
turn.
yonder updates. Not more frequent, monthly yonder updates. Just where are we at with compliance versus non-compliance? Because I think it's a really good story that we should
Yeah.
share as much as often as we can.
Sure.
And then I know this is in Ellen's wheelhouse, but it popped into my head because it could possibly fall as updates for dress code tracking as far as where how many dress code violations are we seeing at the middle school and high school?
Mhm.
And what are our next steps to try to get some clothes?
Right, to address those issues. Yep.
So we could do
Okay.
that. And then,
Weren't you complaining once upon a time in a meeting about so many items? on the
yeah,
items?
but these are
Okay.
new.
I just want to make
These
sure you
are
were the
new
same
items.
person.
I was complaining about the ones that have been on there since I've been on the board.
Well, okay, yeah. And you have any
Those-
more?
That's it. I had
Thank
one, but I
you.
can't remember what that means, so
Well,
I'll think of it and I'll let you know.
can't read I can't do
That's
that
it.
either.
All
My
right.
own handwriting, very difficult, very
Mhm.
difficult. Anyone else? Items for future meetings? Long enough agenda coming up anyway. Comments from the good order, starting with you, Marissa. Right. Thank you for staying and missing that wonderful concert at the middle school.
Well, I don't even know what time it was, because I wasn't paying attention.
Oh,
There
it's,
is a concert, just because of the choral
Yes.
concerts at the middle school
Yeah.
tonight, and might still try to swing by.
Catch
I
it?
run, Sorry.
missed the Humperdinck already,
Thank you, Lauren.
but thank you. Gary,
What's up?
oh, Kathy,
I'm good, thank
Jess?
you.
I would like to know when we are going to have ongoing discussion about the
Oh,
school-based
you
health
wanted
center.
items for future agendas?
No,
No, oh, okay.
no, it needs
You
to
want a
be
date?
something different than that, because this is not something that should be relegated to a subcommittee. This is something that the full board has to have further meaningful conversation on. So that is my comment for the good of the order.
Thank you. Ellen,
All set.
Fiona, good?
I don't make comments, I just have a question. Like if we did have more questions regarding the community health thing, you said put them in writing, what do we?
Well, I think Jess wants them on a board, a full board agenda, right?
Well, it's not
I had
enough
said put them
for
in
me.
writing, but it
Yeah.
sounds like that's not gonna fly.
Well,
I'll
I'm
put them in
not-
writing, just tell me where to put them in writing too, because I don't know.
yeah.
Or a meeting.
That's it. Yeah, you can send it to me and some of these may need to be answered by community health and wellness, like those
Right.
documents we were talking about. They are housed there. I don't have those, so
Right.
they can make
That's
those
why
accessible and then I can
I
share.
didn't ask you, but
Sure.
we should get more information. And we need to figure out what our action steps are. Because. The next question.
And Glenn, that would apply to you, you're willing to write yours down?
Yeah, I'll
So
write them
that-
down.
just
Just
I
tell
have
me-
questions too. I didn't
Okay.
ask, so I'll just I'll write them up and
So
And
does
I send it
anybody
to
want
you.
to be the one person
Or if I
to?
know-
Probably
send them to you.
John, just because he's the chair of that
Send them to
committee
me.
and then he
Send
can
them to
forward
me.
them.
Yeah, and maybe board leadership can figure out what the process should be, and you can let us know or something.
Moving forward for more time to discuss this and deal
Correct.
with questions we might have. Okay, Sue, comments for the good of the order? Sue, comments? Kim, you've been sitting there all night. and Thank you for. No comments. Laura,
All set, thank you.
Is Alan on the phone?
Ally,
I'm good, thank you.
Thank you for being here.
Hi, Al.
Who's the phone call? Oh, is that you, John? Yeah, okay. You have any comments for the good of the order?
Why do you want to leave me next hour?
Okay. Okay,
I'm curious.
looking for a motion to adjourn. Next meeting is November 30th, Midgeon Avenue School next time. Motion to adjourn?
So moved.
Second.
All in favor?
Aye.
Finally, thank you, and we get to
Me too. Okay.